You've read the question twice. All 4 answers seem correct, and somehow the one that you choose doesn't end up being correct. So here's the thing that many nursing students don't realize. Most of your exam questions are designed around the way that nurses think, and that's one simple framework called ADPIE. Once you learn how to think in ADPIE, your exam question answers stop seeming so random and they start to make sense. Hey, I'm Dr. Sherry, registered nurse and nursing instructor, and my goal is to help you learn how to think like a nurse. And today, we're going to be talking about ADPIE. We're going to be breaking that down because it literally quietly shapes a lot of your exam questions, and how understanding it can help you change the way that you approach your test. As you probably already know, ADPIE stands for Assessment, Diagnosis, Planning, Implementation, and Evaluation. Let's start with assessment and break that down. So assessment is literally your foundation. It's everything you see, hear, feel, or measure before you begin to act. Most students end up losing points here not because they don't know what to do, but because they do it too soon. So if a patient says, "I'm short of breath," your first instinct might be to go ahead and apply that oxygen that's already administered, or sit them up in bed, get them in the correct position so that they're breathing better. But the question might really be testing whether or not you recognize that you need more data first. So you have to ask yourself, do I have enough information to act? If the answer is no, then your next step is to assess, not to intervene. Many students want to go ahead and jump to the interventions before gathering all of your information that's needed for your assessment. So don't lose points here. So let's move on to the D, diagnosis. Diagnosis is identifying what's really going on based on your assessment data. So this is when you're grouping together all of your findings to see if you can recognize a pattern. For example, connecting shortness of breath, low O2 sat, and restlessness to a potential oxygenation problem. So even though on your exam questions, you're probably not going to see many questions labeled diagnosis, this phase still matters because it helps you decide what requires your attention first. If your diagnosis or your problem focus is off, then everything that follows that is going to be off as well. So think of your diagnosis as the bridge that's bringing you from what you observed to what you plan to accomplish. Let's move on to our P, our planning phase. Planning is where you decide what your goal is. What's the outcome that you want to see for your patient? So ask yourself, what needs to improve and how will I know when it has, okay? So your plan should always, always, always be goal-oriented and measurable. Don't forget, it needs to be SMART, okay? So if the goal is to improve oxygenation, then everything that comes next, like your interventions, need to be chosen to help you reach that goal. So planning questions are kind of like, well, what's the best initial action, or which goals should the nurse set? They test whether you can think through what success should look like before you go into your action plan. I for implementation. This is the phase that everyone wants to jump to in the very beginning, okay? But this is where you actually carry out the plan. This is when you're teaching, your collaboration, your interventions. This is the phase where all of that happens. But don't forget, before you can implement, you must assess and plan. That's very, very key here. Do not forget to assess and plan. Jumping ahead is one of the most common mistakes that a lot of students make on exams. So once you reach this step, make sure that you focus on actions that directly help you reach the goal that you created in the planning phase. Every intervention should move your patient closer to that outcome. So don't get to the implementation phase and the question gives you all of this assessment data and it asks you, okay, what are you going to do next? You need to make sure that the answer that you choose is something that you are doing, something that you are implementing. If you already have your assessment data, do not choose the option that says assess the patient, because you already have your assessment data. So don't fall into that trick. And our final phase is E, evaluation. Evaluation is when you're closing the loop. You're asking yourself, did all the things that I just implemented, did it work? Did it help my client reach their goal? If the question says after teaching the client or following this intervention, you are in the evaluation phase. You're deciding whether or not the goal was met, unmet, or partially met. And if it wasn't met, guess what? You're starting the cycle all over again. If it wasn't met, you're reassessing and you're doing everything all over again. That's what makes the nursing process continuous, okay? You plan, act, evaluate, and everything should always be patient or client focused and centered. So let's bring it all together. When you're stuck between two good answers, pause and ask yourself, which phase of ADPIE am I in? Still gathering information? Then make sure that you assess. Already acted and you're looking at outcomes, then you're in the evaluation phase. Once you're able to match the question to the correct phase, the right answer is usually going to become really crystal clear. Just remember, ADPIE is not just a checklist. It's literally the way that nurses think, reason, and make safe decisions. And the more that you use it to guide your thought processes, the more confident you're going to feel on exams and eventually in real life, in your real nursing life. So if this breakdown helped you to see ADPIE more clearly, do me a favor and subscribe to my channel for more nursing study tips and more testing strategies. Let me know in the comments what topics you'd like to see me discuss or cover in the future. And don't forget to grab your free nursing study guide using the link in the description below.